Welcome to 3 and 5, an educational series brought to you by CompleteRx. This series launched earlier this year and covers hospital pharmacy news, trends, and more, delivered via videos, blogs, and podcasts. Throughout this series, we will host both CompleteRx and industry subject matter experts who will share their knowledge on a new healthcare topic in each new episode. In today's 3 and 5 episode, we sit down with CompleteRx Systems Director of Pharmacy, Paul Green, and discuss antimicrobial stewardship programs. Since 2014, the Joint Commission requires hospitals, which it accredits, to establish a formal antimicrobial stewardship program. Today, Paul will help us understand what hospital leaders should consider when developing, or if already implemented, how to sustain an effective antimicrobial stewardship program. We're going to welcome Paul today. Thanks for joining us in today's 3 and 5 episode.
Thank you so much, Rachel. It's a pleasure.
Yeah. So, Paul, today we're going to be talking about antimicrobial stewardship programs and some of the questions that we have found come up pretty often with hospital executives when implementing a sustainable antimicrobial stewardship program. One of the first questions that comes up pretty frequently is who should hospital leaders turn to, which departments are involved, and how does pharmacy play a key role in an antimicrobial stewardship program?
That's a great question, and so many people face that when they're trying to start their first antimicrobial stewardship program. In their guidance document entitled Core Elements of Hospital Antibiotic Stewardship Programs, the CDC breaks down these into essential, optimal, and ideal groups. So the essential team members include physicians, including one who specializes in infectious diseases, a pharmacist, and at least one hospital administrator. So if you take it one step further, the optimal group adds representatives from microbiology, epidemiology, infection prevention, and IT. And then the ideal group is the most inclusive, and it adds in nursing, clinical education, environmental services, and quality control into the team.
Okay. Once hospital leaders kind of get these key players in place and the program is established, how can hospital leaders determine the return on investment? What should they look for?
Yes, so that's every hospital administrator's favorite question, especially in these hard times. So the ROI related to antimicrobial stewardship is clinical first and financial second.
Okay.
On the clinical end, optimizing patient clinical outcomes and decreasing the unintended consequences of antimicrobial misuse are key. To measure this, antimicrobial stewardship programs should track their local antibiogram to monitor for antimicrobial resistance patterns. And they should also keep an eye on hospital onset C. diff rates and adverse reactions. Financially, ROI can be monitored by assessing the overall antimicrobial drug spend and also by tracking more indirect measures such as length of stay, duration of therapy, and adherence to national guidelines and recommendations. But in the end, providing quality care costs less in almost every instance, and
Sure.
more ASPs are able to pay for themselves if they just track everything correctly.
Right. And so how often, how frequently should they be meeting to get these kinds of updates?
When you're starting out, I would say at least monthly, if not twice a month, is probably ideal. Once you've really established your program, you've got things that you're tracking on kind of a more long term, you could get away with quarterly.
Okay. Okay. No, that totally makes sense. So another thing that we're sure that is going to be, a pretty popular question these days is in today's environment, we can imagine that COVID-19 is going to come up as hospital leaders begin to implement these types of programs or any other new programs. So how would you say antimicrobial stewardship can or does play a role in the fight against COVID today?
You're absolutely right. This comes up all the time when we're dealing with our antimicrobial stewardship programs at my hospitals. Really, in the face of the current COVID-19 pandemic, antimicrobial stewardship practices continue to show their benefit. So, as new therapies and data become available, healthcare systems must ensure that they're identifying, assessing, and utilizing these in a judicious and appropriate manner. And
Hmm.
ASPs are already set up ideally to be able to process this type of information. So, they should actually be expanded during these times so they can monitor and evaluate the use of antimicrobials and other treatment modalities that are coming out.
Right, right. That makes complete sense. Paul, thank you so much for your time today and for sharing your knowledge on this topic that you're so passionate about. You have certainly helped us better understand Antimicrobial Stewardship Program and done a great job of arming our listeners with some great tips to consider when they're implementing an Antimicrobial Stewardship Program. So thanks so much for your time. We really appreciate it.
Absolutely. Thank you, Rachel.
Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from CompleteRx.